Welcome to Everyday Therapy, a podcast with the goal of empowering you to become the best version of yourself. We hope to meet you wherever you may be on your journey to mental health and well-being. My name is Christa Overson. I'm a licensed therapist and clinical director, and I'm joined by my co-host, Brett Cushing, also a licensed therapist and clinical director. This is the official podcast of Nystrom & Associates, one of the largest behavioral health companies in the country. If you or someone you love is struggling with their mental health, Nystrom has over 50 clinics with dedicated helpers. Visit us at nystromcounseling.com to learn more about the many services we offer. For those of you joining us for the first time, Brett and I have been providing mental health services for a combined 25 years. We both currently practice therapy and oversee a team of mental health providers at our respective clinics. So we're kind of a big deal.
As far as you know. As far as anybody knows, yeah.
Brett, I'm 75.
Yeah.
Just kidding. I am not. But I'm not going to say my age.
Oh, come on.
To keep the
self-disclosure here?
To keep the mystery alive.
Yes. Well, we can say that I'm definitely older than you. Like, we can say that.
Okay. We can say that.
Yeah, we debated if we should have a fun fact.
Yeah, we did.
So how's that for a fun fact?
What?
I don't
that you're
know
older
how
than me?
fun that is, but yeah, I mean,
that is so fun.
I'm like, 14 years older than you probably.
Yeah. But
give or take.
Give or take.
Right.
But we both look so young that people probably think we're in our 20s.
Well, I don't know if it's based on looks or behaviors. Maybe.
It's based on beauty.
Sure. Let's go with that.
Unpopular opinion. Brett told me that I shouldn't refer to a guy as cute.
Yes.
I shouldn't because
a man. Yes.
A guy. Okay, a man. Because I was saying my boyfriend is cute.
Yes.
And Brett said, word to the wise.
Right.
Say he's, handsome or
he's a stud. He's a man, right? Cute kind of has this like a puppy.
Okay.
A puppy can be cute.
It's a cute little puppy.
Right. And a guy's like, hey, I'm not cute, okay?
Okay.
So maybe that's just me. I could be wrong.
Right.
I'll fully admit I could be wrong.
Yeah, but if any of you out there have strong opinions on it, you can keep it to
yourself because we have no way of hearing it.
We don't have a hotline, although wouldn't it be so fun to have a hotline where people could call in and ask us questions live on the air?
Yeah, that would be fun. Yeah.
Oh my gosh, should we give out our cell phone numbers?
Why don't you start?
It's funny. I'm acting as if we're live on the radio right now. I'm like, if I give out my phone number, and someone can call right now.
There, right?
Yeah, exactly.
Well, we want to throw something out there.
Let's do it.
We want to throw out there that therapy doesn't always work, and why doesn't it work?
Right. So if you're in therapy, you've been in therapy, and because Brett and I often will hear from clients about previous therapy experience. So when we hear that from clients, it's like, well, I tried therapy, but it didn't work. Or maybe you know someone in your life who's saying, I went to therapy, but I didn't have a good experience. Mm-hmm. And so we're curious about why, if therapy is not a good experience or doesn't quote unquote work, why is that? Right.
And that's what we want to really try to identify and help us understand better. How do we overcome this so that it's going to, not only we want therapy to be approachable, we want it to be effective.
We do.
And so, and it's frustrating for the therapist and for the person coming in for therapy when it's not working. So
right.
I think for me, what I experience sometimes is I hear kind of two things. Mm-hmm. One, I've heard people say, wow, I'd seen a therapist for like a year, and in 4 sessions, I got so far here in 4 sessions with you than like a year or 2 years with this other person. And I'm not saying that because I'm great.
Well,
but I have heard that, and I know other therapists hear that too from people.
Yes.
And so it's not just me, but I also hear people say, yeah, I just went to therapy and my therapist just sort of always listened and always empathized and sympathized, but I never got anywhere. And so that really frustrates me to no end when I hear people say that. I mean, what a colossal waste of time and resources and money for therapy. And if we're not scratching the itch, if we're not moving the needle here.
Yes, exactly. And there's those certain phrases you hear from clients about their previous therapy experiences that make me think of that sad tuba sound that's like, wah, wah.
Right.
And one of them is that, where it's like, oh yeah, I was in therapy for however long, and it just seemed like we were just chit-chatting. And
Yes.
I'm like, that's my nightmare. Like, to have a client have that as their takeaway from, 6 months to a year of therapy, that we were chit-chatting and like, okay, so that's one. Another one that gives me the sad tuba sound is when someone says, I ended up knowing more about the therapist in the first session or two than they knew about me, or the therapist talked more than I did. So I just want to put that out there for any of you who've maybe never been to therapy, or maybe have never, or maybe if you haven't have had that experience, I want to tell you loud and clear, that is not good therapy. Yes, your therapist might disclose certain things. Yes, your therapist might talk more in some sessions than in others if they're teaching you, or if they're doing skills or psychoeducation. But in general, you should not know more about your therapist in the first few sessions than they know about you. I think this is like my PSA and public service announcement.
Right.
Because it's just like, that is not appropriate, and I don't think that's good therapy.
And I totally agree. Sometimes I'll even say out loud, I'll ask myself, why am I talking so much in a session?
Sure.
And sometimes I'll say to my clients, I think I've been speaking too much.
I do that too.
And I'm just going to shut up.
Yeah.
Yep.
I'll say, I just talked a lot now. I want to hear what you think about that.
Right. And so I think a good part of therapy is that there's some balance there, and we don't want the therapist stealing the spotlight. Like, it's all about them. And self-disclosure can be really helpful. I like self-disclosure. I think it's really effective in normalizing things and like having a connection, so people feel like, oh, I'm not alone. Yeah. My therapist has gone through this. And so exactly. I like self-disclosure as long as it's very intentional to help somebody kind of move along in some fashion.
Exactly. I think that's a great point. I'll add one more piece about self-disclosure. So when I was in grad school training to become a therapist, they said, if you don't have a reason, like a relevant reason for making a disclosure, you should really be cautious, because each thing that you share is going to hopefully illustrate a point, help you connect with the client, help you normalize a problem, so it's not that we have to be so rigid and like, I'm not a real person, but sometimes I'll use personal examples to like humanize some, or like to be like, look, this is everybody, right?
So what does somebody do if they're, and really this even goes beyond just the therapy, any kind of relationship, but let's just keep it here for therapy. Yep. What would you say, Christa, to somebody who is having that experience with their therapist, who is kind of stealing the spotlight, and they're kind of not seeing any progress? They're not getting what they want out of therapy. What do they do?
Great question. So if I had somebody in my life come to me and basically describe this issue, I would say, is it clear to you what you and your therapist are working on? Like, and that might seem like really simplistic, but do you have clear therapy goals? What have you discussed in terms of your treatment plan? At least here at Nystrom, every single patient needs a treatment plan on file, and it gets updated every 6 months, where it's like, these are the goals we're working towards. Now, those can change, those can be updated, but that would be one of my first questions is it clear to you why you're there, what you're working on, right?
Clarity.
Yep. Clarity.
Big
Exactly.
believer in clarity. And
go ahead.
I think people going into therapy then, so it helps a lot of times to know, what is it I want?
Yes.
So if I'm asking for directions, and I call somebody and say, hey, I'm lost. I need directions, and what are they going to say? Well,
they're going to say, where are you, and where do you want to go?
Right. Yeah. And
where would you like to end up?
I need to know that. And I get it. Sometimes people can come in and they're, I don't know. Like, all I know is this. I'm not functioning well. I have a lot of anxiety. It's getting in the way of my relationships. Okay. Yes. But come in with something. Yes. And because I think what happens then is they deny themselves and they defer to the therapist to define all of that for them. Yep. And that creates a dependency then, which we don't want in therapy. We want to empower you. Yep. And so come with a sense of what do I want and how do I know I'm going to get there? And if you don't know that, at least say that. So there's clarity. This is where we're starting. This is where we're going to end. This is how we're going to know that we've arrived.
Yes, exactly. So that would be my first thing. Is there anything you would add to that? Like in terms of, or let's say someone says, maybe I'll ask you this way. Someone says, okay, I went, this actually happened to a friend of mine. I went with a clear agenda. I went to this therapy and we had a limited number of sessions. And the first session, I basically was upfront with the therapist. This is my friend talking. And I said, I would like for these 8 sessions that I have through my insurance or whatever, because every insurance is different, right? I would like to work on this. And it didn't feel like that was really, flushed out. It didn't feel like that was really acknowledged. And so what would you say to someone who's saying, hey, I have a therapist, I have goals, we're not making I feel like I'm not making any progress or I'm not making much progress. What would you say to that?
Well, I would say what keeps you from telling your therapist how you feel.
Nice. I love that.
Yeah. What do you think is keeping you from that?
Okay.
Because that can kind of be really beneath the surface of what's really going on for somebody like that. Like,
sure.
Is that a pattern in your life where you really want something and you kind of withhold that in sharing it with people?
Yeah.
And I also want to empower them that, hey, this is normal. This is okay. We are here for you. You're not here for us. And so tell your therapist then too.
Sure.
Notice why you're not, and then make sure you go and you advocate for yourself. And then if it doesn't change, well, then fire your stinking therapist.
Right.
And that's easier said than done because you've just bared your soul and you've gone in and you've talked to somebody and you don't want to waste your time. This is your time. This is your life. You get to decide what it's going to be like.
Exactly.
And notice then if you're not getting what you want out of therapy and you still keep going to this therapist who's not giving you what you need, then wow, what a waste of time. And this is your life. You get to decide.
Right.
Do I want to stay with this or not?
Exactly. I think this is so helpful too, because I think sometimes, like you were saying earlier, a therapist is seen as an authority figure, I think, right? Yeah. And so same with going to the doctor. Right. Like you go to the doctor, at least I'll speak for myself, and I'm like, they're going to know what I should do. Right. I mean, I come to them with a problem and they are going to give me sort of the treatment or
Right.
So even just imagining confronting a doctor with like, you're not helping me towards my goals,
right,
I think might intimidate some people. And therapists aren't physicians, but I think there is, because I was thinking about, well, what would stop someone from bringing up with their therapist, like, hey, I feel like I'm not really progressing in therapy. It might be that you're sort of intimidated or you're waiting for the therapist to have more answers or you're waiting for, there could be all sorts of things going on.
Right.
But I loved what you said about bringing it up, because I think that can be a pattern for people, right? Is where they kind of just, and this can happen in relationships, friendships, jobs, where it's like, I'm not really getting what I need in this situation, but it doesn't occur to me to like bring it up to anyone or like just like figure out what do I need instead. It's kind of like, I think a lot of times we're just taught to like float along and kind of, well, I'm showing up, right? Yes. Instead of being like, well, it doesn't sound like this is really working for you.
And I think it's a really good opportunity when you do bring it up to your therapist to discover, hopefully, what a healthy confrontation looks and feels like.
Okay.
Because a lot of times we don't experience that in our relationships. And so we're sort of understandably projecting that onto our therapist. Well, if I bring this up, I'm going to be invalidated, I'm going to be ignored or whatever.
Oh my gosh,
and
totally.
Hopefully your therapist will say, okay, well, let's talk about this. Maybe there's some relational repairs. This is how we do that.
Yep.
And so it's a great opportunity for people to learn, so this is how you deal with conflict. In fact, I had some relational repairs once with a client.
Okay.
Because he felt really hurt by what I did.
Okay.
And felt like I just shut him down and I had no idea. And I said, okay, well, thanks for bringing this up. Let's talk about this.
Nice.
And then we talked about it. He said, okay. So I tried to validate how he was feeling. And then I said, okay, so for me, this is where I was coming from. And we talked it through. He was in tears afterward. And he said, I honestly think had I known how to handle conflict like this, my wife and I would still be together today.
Whoa.
Yeah, I'll never forget that.
That's a big statement.
Yeah, so it's an opportunity to learn with your therapist, hey, how do I handle conflict? How do I have a healthy relationship? Yeah.
Yes. And even, on that line of thought, like even expressing a need.
Yes.
I think this is a big thing that I see in like in my clients' relationships and even in my own relationships is how do I express what I need to someone I love or someone I'm close with? And that can feel so scary, right? Because again, if you've had the experience throughout your life of, first of all, not knowing your own needs, that's for starters.
Right.
And then once you know your needs to actually ask, it's like, it can feel really vulnerable to say, hey, I need you to do A, B, and C when I talk about this. Right? Yeah.
Right.
Yep.
I think that these are super powerful because what we're trying to do, really, if you think about it, we're trying to empower listeners to be empowered in therapy.
Exactly.
And know that you have a voice.
Yes.
You have an agenda. You have needs. That's why you're coming.
Yep.
And so I like how you put it, clarity. Let's just have clarity on this. And I would say not only having clarity about what you need, and empowering yourself to voice that, but be ready for confrontation.
Okay.
Expect confrontation as part of your therapy experience. Now, a lot of people can kind of get a little freaked out, like, "Oh, I hate confrontation."
Sure.
And
it's a strong word.
Yeah.
Yeah.
Right. So,
even that word is, can bring up stuff for people, right?
Oh, right.
Yeah.
Yeah. And I confront my clients all the time.
Okay. What does that sound like? Because I think it would be helpful for listeners to know, what does a confrontation from a therapist sound like? Right.
Right.
Ideally.
I think a lot of therapists would like to know, quite frankly.
Yeah. I think anyone listening could benefit.
Yeah. I think people have this idea that, I go to therapy and it's like I'm having coffee with somebody where, like you were saying, we just chit chat. And we do know that the rapport of the relationship, that level of trust, is the number one indicator of success in therapy.
Yes, that's researched.
Yeah, want to support that 100%. But think about it this way, and this is what I tell my staff: is to be a therapist, you're a leader, and they kind of can shrink back at that too. I don't want to be a leader. I just want to be that warm and inviting person.
Presence.
But no, we're leaders because therapy is about change. And so people come in and they want change, but they really don't.
At the same time.
Yes.
Yep.
Because otherwise they would have changed. And so we are helping them by empowering them as we lead them through change that they are resisting. And that, by definition, really necessitates confrontation or conflict.
Yes.
And so I've asked my staff, my therapists, like, hey, how do you confront your clients? And how much education did you get in grad school? How much training did you get on how to confront people? And it's very little. Very little. And so I think therapists need to consider therapy as a leadership endeavor, leading people through change. And then that also means for people coming into therapy, I need to expect I'm going to get confronted on some things.
Yep.
And that's why the trust is so important.
Yep. And it might be uncomfortable. So I think that's another piece to maybe highlight here is therapy shouldn't be week after week I'm coming in and my therapist is just validating and giving empathy, right? And just kind of sitting there agreeing with me and being like, great job. It's not supposed to be like just your cheerleader who just kind of listens to your weekly story, right? And that might seem sort of flippant of me to say, but I think a lot of people that has been their experience, which is why they come in and they say, oh yeah, I tried therapy for a year and my therapist just kind of listened and was like, okay, and great job and all that stuff. And it's like, I just want people to know that that's not what therapy has to be like, right?
Yes.
It's very active. It's very much like we have a plan, we have a direction, Here's what you're saying you want. How can I help you?
Yeah.
Right. And so that's the leadership piece is like, where are we going?
Where are we going? How are we going to know when we're there? And
right.
Going to challenge you when you're getting off course or there's resistance to things, because there's going to be resistance to change. We want it, and yet we don't.
Yep.
So one of the things you asked, like, how do we do this? How do we confront? One of the things I would say is, first, in the negative, we don't give advice.
Thank you. I'm so glad you said that.
Yeah. Because I don't know about you, Christa. I'm sure this is true of you. You can, because of experience, not that you and I are just awesome.
Geniuses. But, we are, but.
When you do this long enough, know, I can know, sometimes I can know just seeing my clients, I know them well enough. I see them in the waiting room, I know what's going on.
Yes.
I can know somebody in my office for the first time, hearing them like 10, 15 minutes, I'd be like, I'm guessing this is probably what's going on. It's probably what they're going to need.
Yeah.
I could just give them advice. We've been done in 20 minutes. The difficulty with that is they're going to reject that because nobody, we don't like to be told what to do.
Yes. Well, another real life application, again, a friend of mine had an intake with one of the online platforms where, you fill out a quiz and they assign you a therapist the same day. And, it's, again, you don't get to talk with someone about your specialties. It's just very like clicking boxes, whatever. Yeah. I won't say the name of the company, but had that experience where first session, she was unpacking some of her story and it was related to health. And so the therapist, unfortunately, in that first session started giving advice about what to do. Again, this is first meeting. This is first.
Right.
So I just wanted to throw that out there as an example of advice is like, it's very shallow. It's very like, oh, you're having health problems? Like, well, have you been to the doctor? And that's an exaggeration, but sadly not that much of an exaggeration, sadly. Oh, you're trying to lose weight. Have you tried Weight Watchers?
Right.
Where it's just like, oh my gosh, like this is not the time because you need to establish.
Yes.
Yeah. So anyway.
And sometimes the advice can be spot on exactly what somebody needs.
Yes.
But they're not ready to hear that.
Right.
And so they need to discover that for themselves. So there's a bit of an art to this. That's why we're not Dr. Phil.
Right.
We don't just say, well, this is what you need to do. Because people need to have this sense of ownership themselves.
Yep.
So like one of the worst and best compliments I got was by the same person within about 30 seconds. He got up and he said, I love coming here. You always give me the best advice. Oh. And I just like, don't
that's the meanest thing anyone's ever said.
Are you kidding me?
As a therapist,
I said, okay, well, that's interesting. Tell me, what advice do I give you?
Nice.
And he said, well, and then he stopped and he thought for a moment. He said, come to think of it, you've never given me advice. And I'm so relieved.
You were like, okay, that was a plot twist.
He said, you're kind of like a mirror for me to see things. And I think of confrontation as mirrors.
Okay.
So I'm good. I like mirrors that are pretty much straight on. I'm okay.
Okay.
I go to a men's store, and they get those mirrors that show all angles.
Oh.
You're right. I'm like, I don't too much TMI, too much information.
I don't need all those angles.
Let's just go to this one. But that's kind of what therapy does. It's the way we confront is to help you see different angles. In fact, our ethics demand of us to help people see the consequences of their decisions.
Right.
And so we're throwing up different kind of angles to view things. And we may not like that. Like you said, going into therapy, you're not always going to like everything. You're not right. You're going to be uncomfortable.
Right. Exactly. And it's not just, ideally, it's not advice and it's not just telling you what you want to hear either.
Yes.
Right. So one of the things that I will, like an agreement I will set up sometimes with clients, especially when clients come in and are very upfront with me, which I love, about I want you to challenge me. I've had clients who are very clear, like, I want you to call me out on things. So, or no, I'm sorry. They'll start off and say, I want you to tell me what to do. Sorry. So the premise is they'll come in and they'll say, I need direction. I need a therapist who's going to tell me what to do about A, B, and C. And I say, okay, well then you and I can make an agreement that when I do that, how would you like me to respond if you say, I already tried that, it didn't
That's
work?
good. Yeah.
Right?
Right.
Or if you say, no, I don't want to do that. Or that won't work because.
Yeah.
Because I want to be, proactive. That's often a response that I'll get is, no, I don't want, that's too hard. Or I don't want to, and again, people have valid reasons why they don't want to do something. But I want them to be aware you're saying this, you want me to tell you what to, give you some skills and options, not advice. But, if you tell me you don't want to do that, I might need to address that with you.
Yeah.
If it's a pattern, right?
Yeah. I love how you really brought that up, because that's really what's behind that a lot of times is I need you to just tell me what to do. Well, first of all, it's fostering that dependency again.
Right.
I need you. And I love how you dispel that.
Yep.
I think for me, it's not just advice and different ways I try to be that mirror for people. One, I just inquire. I ask questions. So like you said, you gave the example of somebody who says, therapy is not working for me.
Yep.
What would you say to that person? And my response was to ask a question.
Exactly.
And asking the question
Yep.
was a way to challenge them.
Exactly.
Why do you think you haven't brought this up?
Yep.
And so I'm being confrontational with them, but it doesn't feel,
Yes.
like I'm really hounding them. There isn't this conflict that's uncomfortable. It's an invitation for them. So my confronting is by asking a question, and it's an invitation for them to start thinking, looking at a blind spot, looking at another angle in the mirror, and start asking themselves questions to empower them.
Right. Exactly.
And
exactly.
I think another thing I do is I'll just make observations. So I'm listening to you. And as I'm listening to you, I notice you say you're not angry, but I've noticed your hands are really, flailing.
Right.
And it sounds to me like there's a lot of energy here. I try not to say you're angry.
Exactly.
Yes,
I love that.
There's a lot of energy there.
Yep.
And I've noticed you're sitting on the edge of the couch there,
right.
and you're leaning forward. And so I'm just observing that. What do you think that's about?
Exactly.
And so I like to do a question. I like to do an observation. And then there's a thing of immediacy. And I think this is important in therapy, where you're going to have an issue with your therapist, or your therapist might have an issue with you and say, I'm getting a little frustrated because of this.
Yes.
And that's another way of confronting is hey, we've been talking about this for 4 months, and we kind of keep going over the same thing. We're not getting anywhere. And I just got to be really open. I'm getting a little drained or frustrated with this. Do you feel that? And so we call that immediacy to talk about relational dynamics that are getting in the way.
Exactly.
So
exactly.
Those are things I try to do to help people by confronting and challenging them. And I think that's what you should expect.
Yep.
And kind of like what you're saying, be ready for that uncomfortableness.
Yes, exactly. So to kind of wrap us up, I want to just highlight, if you go to nystromcounseling.com, one of the things on the website, if you go to our providers or go to providers, and then you can sort by the different clinics. And Nystrom has over 50 clinics now in, I think, 5 states. And so if you sort by the clinics closest to you, you can actually see a profile of the different therapists. You can see their specialties. And it's okay if you don't hit it off with your therapist the first session. You don't have to, just because you start with someone, you don't have to continue with the same therapist. You can ask them questions in your intake. Tell me about your approach. Tell me about, it almost it doesn't have to be this one-sided relationship where they're always bombarding you with questions. You can say, how are you going to help me get to my goals? And I think people can be more proactive when they're choosing a therapist, and then moving on if it's not a fit.
I think that's so important to feel free to do that unapologetically.
Yes.
And I would also just say, you in any good therapy session, you want that clarity that you were talking about. There needs to be confrontation, because change, we're after change. And I would say in the most simplistic sense, make sure that you're not only coming with clarity, ready for confrontation. You want an experience with your therapist where there's always acceptance and there's change.
Sure.
And there's a balance of both, but there's always leading with validation and balancing it out then with change. And if there's not that, or if there's always change first and there's no validation, if there isn't clarity, if there's no confrontation, it's likely not going to work.
Yes, exactly. Well said. Well, thank you for joining us today on Everyday Therapy. We hope that we've empowered you to become the best version of yourself. You can check us out at nystromcounseling.com, and we hope to see you on the next one.
Thank you as always for listening, and please be sure to leave us a review. While this podcast can't be a replacement for therapy, we hope you enjoyed our discussion today and join us again next time. Nystrom & Associates is always available to those who are struggling. If you find yourself in need of support and help, please check us out at nystromcounseling.com.